Let's begin with the training on the basic suture techniques of microvessels. There are 4 steps. Let's take a look at them one by one. You should hold a needle with a needle holder so that they make an angle of 90 degrees. Remember to hold right above the middle of the needle. If you directly hold the vessel with forceps, you can damage the vessel wall. Therefore, be careful to not do so and begin with the suturing. With your left hand, place the forceps under where you desire to suture to lift up the vessel. Pierce through the tissue perpendicularly with the needle. You should insert the needle at a point where the distance is 3 times of the needle thickness away from the cut surface. You should do the same on the other side and insert the needle perpendicular to the tissue. Push down with the forceps on the other side where the needle is supposed to come out and push the needle through. Pull the needle with the forceps on the left hand. In the meantime, use the needle holder on the right hand to allow the thread to pass through perpendicular to the tissue. Pull the thread all the way through until approximately 3 mm is left on the starting side. Once the needle is pulled out, hold the suture thread on the needle side with the forceps approximately 1 cm away from the tissue. Make a loop around the tip of the needle holder. It's easier to tie if you make the loop near the thread on the starting side. Make 2 loops for a double throw and make 1 loop for a single throw. When you're done with making loops, hold the thread on the starting side with the needle holder. While holding the thread, pull out the needle holder from the loop to make the first knot. Be careful to not entangle the knot. When you're making a knot, make sure that the cut surfaces on each side touch only slightly. Be careful to not tie very tightly. For the second knot, hold the thread with the needle holder to make a loop and make a knot in the opposite direction. For the third knot, repeat the same but in the same direction as the first one. Make 3 knots to make 1 stitch. Let's watch a video clip to visually learn about how to make 1 stitch. Hold a needle. Under the microscope, it's easier to hold a needle while it's sitting on a surface. Tissue eversion. Insert the needle. Tissue eversion. Insert the needle. Pull the suture thread. Tie a knot. To make 1 stitch, make 3 single throw knots. Make sure that the cut surfaces are only slightly touching each other. Be careful to not tie tightly. Once you're done making 1 stitch, cut the thread with a pair of scissors. You can prevent losing the needle by cutting the needle side last. This is the end of the training on the basic suture techniques. Thank you.